The Blaine Young Show, weekdays from 3 to 5 on 930 WFMD.
Dollars last year from the trial
There
lawyers.
you go.
Well, but look, Congress is getting what did I tell you? It's $2,000-something a day per congressman to lobby. Mm-hmm. $1.4 million a day they're paying to lobby Congress. But the thing that you talk about not having tort reform, and that's important. But the whole problem is, what did you say? We have 91% of the people are covered.
Yeah.
That means 9% of the people are not covered.
8.5 million people truly don't have insurance. They can't afford it out of like almost 300 million
That
people.
doesn't mean they don't have care. That means they don't have insurance.
That's right.
That's correct. So here we are making this big to-do about all this crap, and we're only talking about that small number of people.
Right.
And we're redoing the entire health care system for that small number of people.
It's that way with everything in government, unfortunately, Anita.
Wrong.
Hilda, welcome to the program.
I do not have health care out of choice. I'm a senior. We had it, and the year they only made 36% on us. They upped their premiums $46 a month. So I put my $200 in the bank. But that's not why I'm calling.
Okay.
I'm not on medication, taking aspirin today and glucosamine. But I went to a doctor about my throat after I was forced to go to the GP first, and the specialist told me I had 81 reasons why my throat was no good. Go home and keep my mouth shut, which means my mouth is worn out like me, I guess. And I laughed about it, but it kind of irked me because I worked hard to be 81 and be healthy. So what should I have said to the doctor? I'm not going to sue him because I'm not going to sue anybody. I think that's stupid. But anyway, it did irk me. I went to the orthopedic.
Well, are there some other doctors that you could go see besides?
I'm not going to fool with it. I mean.
Yeah. Well, I think that, number one, ma'am, I can't apologize for the doctors in the world, but I can say it's totally inappropriate. I mean, what a doctor has to show you is compassion. And when you come into the office, ma'am, you're the most important thing in my life for that 15-minute routine visit or an hour when you see me for an emergency. And for someone to demonstrate that type of comment, it's not becoming of a physician, number one. Number two, I think it's important that you keep some type of insurance because you're a young 81 perhaps, but God does call you back sooner than later, but we can postpone that call from Jesus or wherever you want to call God. And I think you should have an annual physical to make sure that your cardiovascular system is intact, that you're cancer-free, and that you have a good health care. Now, think about you. You're 81 years of age. Do you realize you've outlived most of your colleagues in this country that live up to 78? So you're genetically superior compared to the general population. But for the rest of America, it doesn't have your blessed genes, so to speak. They need affordable health care. And that's where Blaine and I think, are on the same wavelength. It's got to be affordable. Like, for instance, my insurance policy costs me $14,000. My relative pays like $8,000 who works for the federal government because they have buying power. Why should I pay that much more money for the same policy? And I live literally 40 miles outside of Washington, D.C. Everyone in our catchment area in the Baltimore-Washington area should pay the same amount for a Blue Cross Blue Shield policy. A small business of 40 employees should have the same as a company that has 4,000 employees. And that's where the insurance companies have to be so regulated to offer this good basement rate policy to all people who are capable to it. Now, when it comes to poor people, we have Medicaid. Now, it's interesting. Half the people I met who come in who are eligible for Medicaid are not on Medicaid.
Thank you, Hilda.
You're welcome.
Yeah, they're not on Medicaid, Blaine. It's unusual because the government has failed. The federal and state governments failed to get these people enrolled in these programs. And we feel all the paperwork for them is very daunting and it's challenging. But the federal government, they're complaining about how to run things. They can't even run Medicaid right.
Well, at Medicaid, you had to have basically no assets at all. That's the major problem with Medicaid.
Yeah.
So, I mean, it was fine 30 years ago when you said you couldn't have assets of more than $2,500. Just like now you have for real estate, but you can't have assets of more than 30.
Right. But these people should be able to have that. They have the right to have the insurance, but you still don't get it. That's the problem. And they don't get any preventive care.
Tom from Pointer Rocks. Go ahead, Tom.
Yeah, I had a question about tort reform. One of the things that I haven't heard in the conversation so far was an alternative to legislating caps on damages for lawsuits. I certainly agree that needs to be part of the solution. But one thing that's been proposed I haven't heard a lot about was a voluntary agreement between a doctor and a patient, say before a surgery. In exchange for a lower rate on the surgery, the patient would agree to have an insurance policy in their name taken out by the hospital, and then if something went wrong, they would basically give away their right to sue in exchange for accepting as the damages the insurance policy.
Yeah,
That's like flight insurance.
Yeah, that's actually been challenged. Yeah. That's actually been challenged because you have a constitutional right to sue. And a lot of doctors wanted to have, for instance, contracts with patients. If they follow the standard of care, you couldn't sue them. But let's go back to your initial question. What's there for tort reform? There's only 2 sentences in there. If I volunteer for smallpox, I worked at Genesis Project, and I now belong to this organization. I can practice medicine anywhere in the United States in any type of disaster. And if I get sued in Texas, for giving an injection, this new bill will provide me with malpractice coverage. Well, that happens once in a billion years where we're doing smallpox vaccinations. But what we want is real tort reform. Number one, do you realize 37% shortage here in Maryland right now for physicians? They leave our great state. 58% of the class graduate leaves and goes to Texas, Wisconsin, where they have a cap on pain and suffering. So if a patient has $1 million injury, they should get the full $1 million. They shouldn't give $300,000 to the lawyer for contingency, number one. Number two, there should be a cap on pain and suffering. You shouldn't get $54 million suffering because you died of tobacco smoking because you didn't know it was a bad thing to do. That's busting the bank for the malpractice companies that cover us. And number three, you have to have an arbitration board where you get citizens on the board. They review the case, and you have to accept the decision of the arbitration board, just like disability.
Sure.
You don't have to go through like $400,000 worth of lawyers, making them rich and just perpetuating that greedy system. Go to an arbitration board, accept the award that you get to the patient, and then make it more efficient. I'll guarantee you these capricious lawsuits would drop real quick. If you don't give these people, it's like AIG bonuses.
All right, Tom. Thanks for the call, Rick Weldon, Delegate Weldon. How you doing?
Hey, Rick.
I'm doing great, Blaine, Anita, and Dr. Vitarello. Here's my 30-second solution. It's a combination of tort reform. It's a requirement that insurance companies cover pre-existing conditions. And on the economic side, give everybody who can't afford it a basic HMO insurance policy out of the private insurance market without creating a government-run health insurance rubric. What that does then is it gets sick, poor people out of the community hospital ERs because they'll now be able to get the preventative and primary care that they need instead of waiting until their illness becomes chronic and they do present at the ER. If we just did that, Blaine, I think we could fix this problem without creating a government-run...
Well, that's what we want. Absolutely, Mr. That's exactly what we want. As I was talking to Anita before, is that, for instance, let's look at the people on the uninsured. About 25% of college students. And I was talking, young people don't need a high-end premium. They need an HMO coverage, just like you said.
Right.
Catastrophic, in case they break their leg in a car accident, with a high deductible. So if they have a urinary tract infection, they pay, $45 at the doctor's office. Make $1,500 to $2,000 a year. Then you give people a basic product through Blue Cross, or one of the 1,200 companies offers you the basic package. That's maybe $4,000, but you buy it in a group rate. So if you have 40 million people buying into it, instead of costing $8,000 a year, it's only $4,000, the basic HMO. Then you have the traditional other packages, which should also be paid at a discount based on the buying rate of the federal government. Why doesn't Obama come forward and say, listen, guess what? I want to give you the same rates I got. Why do they do? You know why they don't do that for? I'll tell you, right? Profit. And you can see the effect of the industry right now that's swaying these guys not to go for this plan that you have. All the doctors want what you want, by the way. You know that.
Yep.
Keep government out of the administrative costs.
Sure we
Why?
can't get you to run again, Rick?
I didn't hear you. What?
Sure we can't get you to run again, Rick?
No, I think I've had my fill, Anita.
Oh, no. We keep talking.
See you, Rick. That wraps
Take care,
up the
Mr.
program. Anita, thank you, Frank. Pat, thank you. Dr. Vitarello, talk to you next week. Congressman Bartlett's going to be in the studio on the 26th. And you going to come on 26th also?
What day is that? Wednesday.
Wednesday.
I'm going to be in Gettysburg. I'm taking my son to college, but I'm going to be with you Tuesday and Thursday night with
That's
Bartlett.
right. All right.